Thank you all for joining us for our afternoon session. I hope everybody had a great first morning session, but now we will be talking in this session about the Linkages screening tool. And we'll talk a little bit about the components of what that screening tool will look like, as well as what's currently in development and the progress that our Linkages Prevention and Early Intervention team has been able to work through, along with our team over at CFPIC. So with that, welcome, and I am going to let you all hear from Dana and Andrea, and then lastly myself. I'll introduce myself. But this is our team here today from CFPIC that will be joining to talk through linkages and the screening tool. So I will start with Dana. Pass it over to you.
Dana, you're on mute.
Oh, yeah.
I'm Dana Fabella, the Linkages Program Director, and I've been fortunate to be able to run Linkages, which is the CalWORKs Child Welfare collaboration, for many years since we began the work here at CFPIC in 2006.
Thanks, Dana, and we'll pass it over to Andrea.
I'm Andrea Lewis, Linkages Program Associate. I've been with Child and Family Policy Institute of California for almost 2 years now, and excited to be here and a part of this work. Thank you.
Thanks so much, Andrea. And my name is Derek Slama. I am the Prevention Program Director with CFPIC, supporting the connections with all of our prevention work within CFPIC and supporting the Linkages team as I can with further moving upstream as we think of the screening tool and other prevention approaches for linkages, but also families seeking support through self-sufficiency or public assistance programs. All right, well, and we will go ahead and start by just sharing a little bit about what the objectives are for our workshop today. So we have 3 key objectives that you'll see here, and I'll just read through those briefly, but help us kind of connect to what we really want to try to achieve in the end with this workshop, and hope that folks can take back with their teams or to reflect on. But first being, we really want to make sure we know that CalWORKs is a huge piece to prevention. And so we want to convey that key role of how CalWORKs fits in to the prevention ecosystem and prevention services, especially when we talk about providing access. We want to also introduce the importance of screening families or screening the needs for families that are seeking benefits for anything for their strengths, their needs, and for access to other services beyond just what's offered within self-sufficiency programs. And then we want to understand, hoping folks can understand the process for developing and piloting a screening tool that can be utilized within self-sufficiency and public assistance programs to really help as we build out a community pathway with no wrong door, really trying to identify all of the other supports we can connect families to. And so we will be, and then part of this is also at the end, which we see here, is really being able to provide feedback on the screening tool. So there's going to be an opportunity for folks that are joining us here today as well to provide feedback. So for our agenda, we're going to provide some background understanding of linkages from my colleagues here at CFPIC, who will walk through that. And we'll also talk through how CalWORKs, as I mentioned, will fit into a larger role within prevention. We also want to discuss why screening and assessing the needs of families early on matters, as we truly build out community pathways with no wrong door, and to access services, along with that this really fits within self-sufficiency and public assistance programs. And then lastly, we'll discuss how CFPIC, in partnership with that Linkages Prevention and Early Intervention Committee, is thinking about developing the screening tool, and end out with a discussion so that you can provide that feedback on the screening tool and next steps. And so what we're going to start with is a brief poll. I think we want to get a pulse in the room of who is here and with familiarity with the Linkages program before we go into an explanation and background on it. really want to see with the group here today, what is your familiarity with linkages? So we have a couple options. So you are maybe involved in linkages in your county, you're aware of linkages, but you're not directly involved, or maybe you want some more information about linkages. So we'll give folks about 30 seconds to respond to that poll. All right, give about 5 more seconds. We got it about 80%, and I will go ahead and end the poll. And so it looks like a bit over half of the folks actually, yeah, 65% want more information about linkages. So it sounds like maybe linkages isn't offered in your county, or maybe you're looking to explore how to be a partner, a linkages partner, or join linkages in your county. Some folks are aware of linkages, but not directly involved. So maybe your county has it, but you're not directly involved with that within your county. But love to see a good chunk of our group here today as well being involved in linkages in their county. Thanks so much, everyone. And I think with that, we will go ahead and pass it over to Dana to share a little bit more about linkages.
Thank you so much for that, Derek. And thank you all of you that are here today. And it was nice to see some of the names that I recognize from the linkages counties and coordinators on this call. So I'm really pleased to see that. I was reminded at a presentation I was just at by Chapin Hall around the beginning of this TANF child welfare collaboration, which really began in Colorado in 1997 when their director, David Burns, began to try to coordinate and integrate the use of TANF in child welfare programs. And in 2000, the state of California, along with CDSS from their self-sufficiency CalWORKs program, child welfare program, and some counties did a trip to Colorado to take a look at this child welfare and CalWORKs collaboration that was going on in Colorado. Brought back a lot of really great ideas, and they formed a lot of work groups that then set actually the policy and the framework for the original linkages, or Linkages 1.0 as we call it now. That work, they did some planning work for a few years, and in 2003 they began to pilot it. The strategies that were developed around coordinating child welfare and CalWORKs. In 2005 or so, it was turned over to CFPIC. When it first started, it was under the California Center for Research on Women and Families. But in 2005, it came to CFPIC. And in 2006, when we ran out of funding for grant funding for it, we applied for a federal grant, Administration for Children and Family. We applied for that grant with OCAP, with CDSS, the Office of Child Abuse Prevention. We were one of 5 states that got the child welfare CalWORKs coordination grant. And we expanded from the original 13 counties that piloted that initial work to about 29 counties that were working with us on what we call the coordination of child welfare and CalWORKs when there were mutual families. So we expanded to about 32 counties at that point in 2006. The federal grant and then private and funding through CWDA and CDSS OCAP lasted until about 2014. And at that point, 2014, it was like, okay, so counties need to kind of pick this up. And at that point, we really didn't have funding. And then in 2016, we sort of went silent in terms of our support. Many counties on this call, I think, continued their work of coordinated case planning. But in about 2019, and we know what 2019 started, was the COVID, the pandemic. During that time, we were planning, and I say we, it's CDSS, developed a planning committee, including CFPIC on that planning committee, as well as counties, to rethink linkages. If we resurrected it, if they refunded it, what did we want it to be? And at that point, that planning committee decided to align it where child welfare was going, which was prevention, and where CalWORKs was going, which was family engagement. Hence the OCAP framework of prevention, early intervention, or what we call primary and secondary and tertiary was created. So instead of just looking at the deep end, if you will, the tertiary, the coordinated case planning, we really embrace the prevention and early intervention. And we started this whole prevention and early intervention subcommittee, which Derek now is co-leading with our former director. So that's a little bit about our history. And in 2021, I should say, we were funded for what we call now the Linkages 2.0 strategy, sort of the overview. I mean, the new framework of our Child Welfare and CalWORKs prevention program now. So we see linkages as a critical strategy for enhancing the coordination between CalWORKs and child welfare families. And often these programs serve the same families. We know that. Many of those families come into child welfare. But these programs lack, and social workers lack, the communication, leading to the kind of the inefficiencies. One of the reasons we created the coordinated case planning was because we knew that there was requirements on the child welfare side, requirements on the CalWORK side that families had to meet. So we wanted to make sure those were coordinated, and that it was help families to meet the case plans on both sides of those houses, if you will. And very importantly, it was to improve services. That was one of the reasons CDSS was interested in looking at linkages again, was to look at increasing services to families and supports. And then we know that our CalWORKs program, and you'll hear a little bit more about that in a moment, has a lot of supports and serve those families that are most in need. It streamlines, it creates, reduces referrals, it aligns timelines, all those things. Reduce risk to families by providing the supports they need, the child safety supports they need, and reduces the risk of maltreatment. So those are some of the things that we see are important about our Linkages 2.0 strategy. And just to let you know, some of the things, the key strategies include coordinated case planning. That's still very important to the linkages strategy, even though we call ourselves Linkages 2.0, that Linkages 1.0 strategy, which was the coordination of case planning, is still important. It's that team collaboration. We would really want our CalWORKs workers at those child and family team meetings whenever possible, creating those teams to leverage those resources family needs. And another important part of linkages too is the cross-training, the training of both the child welfare and the CalWORKs workers together, so that they'll have they'll share knowledge of each other's program. It's very interesting. Child welfare does not often know the supports that CalWORKs can provide. And CalWORKs doesn't, CalWORKs might have the idea that all child welfare wants to do is remove children, when in fact that really isn't true. Keeping children home is really a major tenet for all child welfare programs in our state. But I think for us to just remember that primary, secondary, and tertiary. Tertiary is that deep end that we have been doing. And as we move into primary, it's really looking at providing those concrete supports before some challenges arise. And secondary, that early intervention, I call it, is assisting families at risk. And we know both sides want to do that. I know CalWORKs does that through a lot of family stabilization and home visiting works. So that's just a little bit of the overview of Linkages 2.0, and just to let you know that, let's see, our last, see where we are. Where are we now? Next slide. Is that the last slide? I think I have one more. Is that correct? Okay. So these are just some of the key takeaways, if you will. Think about this. It's really a dynamic and effective approach, because we're not talking about just between the workers. We're talking about between those two systems, child welfare and CalWORKs. Those two systems collaborating together can create sort of a continuum of services for vulnerable families. It deepens that collaboration between CalWORKs and child welfare. They're in a social services agency. I know Los Angeles, you have two separate agencies, but most of these programs are in the same agency. And so it strengthens that coordination and the supports each can provide. The focus on prevention is really important, because it really addresses the family strengths. And we've got, that's part of what we're hoping when you see the screening tool where we're trying to go to, is really think about how we can screen for some other things as we're screening maybe for economic supports. So the comprehensive comprehensive support for families, it's really important to think about that system between primary, secondary, and tertiary, and how these two systems, as well as social workers, can play an important part in creating a system and a coordinated approach to vulnerable families in the county, any county you're in. So if you are interested, we'll hope you'll reach out to us to find out more. And now we have another poll, I believe, or we're going to, no, I'm going over to Andrea.
Yeah, this would be me. And as Dana mentioned earlier, Linkages 2.0 embraces the prevention framework. We see CalWORKs as the #1 prevention program in California with a larger reach than any other program. Research has shown that when parents receive support through programs like CalWORKs and TANF, children are less likely to experience abuse or neglect, and they tend to perform better academically, socially, and emotionally. There are several ways that participation in CalWORKs prevents child maltreatment. CalWORKs, also known as TANF, provides cash assistance to low-income families, helping to alleviate financial strain. Financial hardship is a well-documented risk factor for child abuse and neglect. By providing a stable income, CalWORKs can reduce the economic stress that can contribute to family conflict or abuse. CalWORKs participants may be able to access job search supports, transportation, clothing. That clothing can be for a job interview or a court hearing. Parenting education, counseling, and case management. These services can equip parents with skills and knowledge to better care for their children, manage stress, and understand child development, which can help prevent harmful parenting behaviors. CalWORKs can connect families to community resources and concrete supports, such as food banks, housing assistance, childcare, or other community-based prevention services, which help to reduce stress and build a stronger social support network that can serve as a safety net in times of crises. Children whose families engage in CalWORKs often experience improved overall well-being and have better development outcomes because they live in more stable, supportive environments with their basic needs constantly and consistently, hopefully. Linkages is working to build more opportunities to help families across services and supports even before they become involved with child welfare or CalWORKs by developing our Protective Factors brochure and our screening tool. Before we dig into the screening tool, I want to say a few words about the Protective Factors brochure. I'm also going to drop the our toolkit. Oh, it should be going in. Sorry about that. I added our linkages toolkit towards the Protective Factors brochure in both English and Spanish, along with the ACIN that goes along with it. Linkages counties have worked together in the Linkages Prevention and Early Intervention Committee to develop a brochure that highlights the protective factors, provides examples of what families can do to increase protective factors, and be customized by counties to highlight local services for families. For those who are unfamiliar, briefly, I want to go over some of the 5 protective factors with you really quickly. Parent resilience is managing stress and coping with challenges effectively. Social connections, building supportive relationships for emotional and practical supports. Knowledge of parenting and child development, understanding effective parenting strategies and child development. Concrete support in times of need, ensuring access to essential resources and services to alleviate family stress. Social and emotional competence of children, helping children develop emotional regulation, communication, and relationship skills. The Protective Factors brochure supports prevention by giving families tips for growing their protective factors and connections to services that could enhance their protective factors and strengthen their family. It allows for an early identification of needs. It highlights areas where families may lack resources or support, examples of like resilience and social connections. Serves as a framework for identifying potential risks before they escalate. Provides targeted supports and interventions, encourages the use of resources and services to build resilience, parenting knowledge, and access to those concrete supports that are needed, and provides a consistent research-based backed framework that can guide service providers in developing equitable and effective prevention strategies. Moving beyond the brochure, the Prevention and Early Intervention Committee identified a need for a screening tool to allow for early screening of families seeking benefits so that they could be connected to services. We know there is an assessment that happens for most families once they engage with the self-sufficiency agency, but we hope that this tool will provide an earlier connection to community-based services or connect families to services if they do not meet eligibility for CalWORKs or other benefits programs. And Derek, if you're ready, you can go ahead and get started a little bit more about the tool.
Yeah, great. Thanks so much, and Andrea and Dana for giving. I think you give a great foundation to help me. Just as we talk through the screening tool and what really is the purpose for it, and what's the background of developing the screening tool, and where are we thinking of going forward with it. I just want to start by backing up a little bit to share that why are we thinking of a screening tool for assessing needs of families to be able to connect them with the services and supports in the community they might need. And so part of this, I mean, thinking back to some of the research that CFPIC had engaged in with other external researchers some years back, I think back in the earlier 2000s, where we were able to start, that was kind of a leveraging point for us to start thinking about some of the gaps for families when they're seeking support in self-sufficiency programs. And one of those is when we look at I'm not sure how familiar folks are with it, but if we look at child-only cases, for example, and this is where maybe the families receive CalWORKs for their children, but not necessarily for themselves, and they're not engaged in the employment-seeking aspect of CalWORKs, welfare to work. So that's where there's a difference, and I think what we see is that families still have remaining needs when they go in to get support through self-sufficiency programs. And otherwise public assistance offices, that office can't necessarily, meet those other needs that are coming up. If we think of other parenting specific needs or other concrete supports beyond what those programs can provide, we really see that that's a great entry point for families to really learn about what their needs are and connect them with supports quickly and easily and seamlessly. And so that's one piece, but also thinking about community pathways. And this is a great opportunity for us to think about how could we build in this no wrong door for services and supports through community pathways that not all, but many counties are thinking through. I think there's over 30 counties at this point that are thinking through community pathways. And this is a way to start thinking about how could we route families to services and supports and embed something, whether that's in the public assistance office or if that's through other community-based partners. What is something that we can set up that can help connect families quickly to the services and supports? And thanks so much, Shana. It's those specific, the majority of families are not in the welfare to work program. And so that's where the gap really lies for those families that are still needing those concrete supports. So all that to say that, you see a few points here also of, it supports informed decisions on a higher level as we think about meeting those individual needs. It helps that person, whether that's somebody helping connect to the services or conducting the screening tool themselves. It helps them to have a way to connect families with those specific needs. At the same time, promoting prevention and early intervention. So that's a great opportunity for when families are entering to receive support and services through the CalWORKs or even applying for CalFresh and so forth. That's a great entry point to identify where they can be routed for support. But I think it goes beyond just the individual level as well. This gives us an opportunity to look at a higher level, whether that's in our county, our region, in a tribe, and California statewide, to look on a higher level to see where are families identifying that there's these needs and where is this larger gap in the service array that we have in the communities. And so, and then lastly, I think, it lets us also measure over time, how are we improving outcomes for families as they continue to seek these supports to get connected to the services that they're really truly needing or looking for. Next slide. And so I'm going to talk a little bit about the process for developing the screening tool, where we're at, where we're going again. And again, going back to, I'll talk a little bit about the goals for the screening tool, where you'll see here on the next slide that we're talking through the identifying strengths and needs as being, the major tenet of this goal for the screening tool. I think what we've been able to do in our work thus far is we did a landscape scan of all of the screening tools, or many screening tools that are available across the nation, and compiled what might be the best fitting for California, based off of the needs that we're seeing families experience, or understanding the context of different agencies of how they would implement a screening tool. I think what we learned in that research is that we need something a little more unique for California to meet our needs. And so I think, we're still leveraging some of those tools that are out there to understand how to build this screening tool. But at the same time, we're going through, and I'll talk a little bit more about our stakeholder engagement and constituent engagement process to make sure folks are really included in the process for how we're actually developing the tool. But again, I think what we also identified through that process is that a lot of these screening tools assess for needs, but not also strengths. So I think what part of the goal is for this is looking at strengths that the family can already leverage and helping to highlight those, but at the same time, connecting to the needs that the families might be looking for themselves. Of course, supporting prevention efforts, and I say prevention efforts, but I really want to expand to looking at just well-being efforts at large across the state. And then facilitating service coordination. So we know our Linkages program is great at facilitating the connection and bridging the CalWORKs and child welfare space of bridging for families receiving support and services and coordination through that program. But this is really helping to take that next step to really facilitate those service coordination earlier on before needing that connection and involvement between child welfare and CalWORKs. And then promoting equity and accessibility. So making sure that there's this inclusivity and inclusive framework that really is integrating all of the diverse needs that families might have walking into a public assistance program. We know that families are gonna, screening tools are great, but at the same time, if it's not necessarily in a manner that's culturally responsive, identifies their language, but also the varying context of the language within the screening tool of how that information might be perceived, or and how that might influence how they respond. All of those pieces we're trying to build out in our goals for building this screening tool out. And then streamlining decision-making and enhancing outcomes for families. So making sure that there's this data-driven decision-making process to really identify what the needs and what the connection to those services are and the service array that's out there. And then empowering families with a user-friendly self-service tool, while also offering staff-assisted options for additional support as it's possible. And then lastly, going back to this larger continuous quality improvement effort to generate, the data that we really need to help counties assess the effectiveness of prevention strategies and help refine what those practices and services look like over time. So really a lot of goals we have for this screening tool to try to really build it into our larger prevention service and prevention initiatives. But I want to talk a little bit about what some key elements of the tool will also look like. We have our core screening components, so looking at needs assessment. So we're exploring, what are the different domains or areas of need that we really need to make sure is inclusive within this. We also, I think the challenge we've started to run into is that this will differ based on individual and community, right? And what's also available within communities. And so having a statewide standard tool is challenging for making sure that it's responsive to all the community's needs. And so where we are looking at different areas is, where we're finding families with economic stability needs, housing, employment, income support, also looking at what is just safety and well-being overall, any stressors that arise for the family, access to other resources, so childcare, transportation, healthcare access. And then we really want to embed throughout the entirety of this in alignment with our protective factors brochure, the 5 protective factors. This is really helping to drive some of the screening tool components, but making sure that it's being included in a way that it makes sense for families and that they feel like the answers are really, the questions and how they answer is really getting to their needs. And then we, see alignment with prevention efforts. So I also want to point out, we, especially if we're thinking about leveraging specific starting points of how will this roll out over time, we know that there's evidence-based programs being offered out in the community now that are going to with this comprehensive prevention planning. And so how can we cross-coordinate with what's happening there to make sure families are also connected with EBPs? And that's just one example. We think of this as also a strategy. If we think about the shift from mandated reporting to community supporting, how is this also embedding that practice and making sure that there's community supporters actually connecting families through these programs and based off the results of screening tools. And then we include this potential for dynamic scoring and prioritization really as a way, as an opportunity for counties to look at if counties are wanting to implement using weighted responses to prioritize families needing immediate prevention or early intervention services, but also making sure that there is a way to prioritize that, but also understanding the individual context and needs of the families as well. So we have some accessibility features, the different ways that we're looking at the elements of actually accessibility of the tool. There's many different options and that we're going to explore with you all today. And so that's first self-service option. So would it maybe look like having a kiosk in the lobby of a self-sufficiency public assistance program? Would it also be looking at actually having a staff administer the survey or the screening tool with a family and then connect them with a warm handoff? Are there ways to build it into already existing practices that are happening within those programs? So we're looking at different ways of that. And then the language accessibility, I've already talked a little bit about just making sure the cultural responsiveness of ensuring language access, as well as taking into consideration ADA and other inclusivity for cultural relevance and humility. And then usability and design. We really want it to make sense for families and whoever might be administering the tool. So making sure that it's intuitive, making sure that there's also a way to protect the anonymity of families that are completing the survey tool or the screening tool. And so that's where we're really trying to figure out how can we ensure that happens and also give the guidance to those counties that might be implementing a screening tool to ensure that they are able to understand how that screening tool will be used by protecting the privacy of folks. And then interactive features, so making sure that it's very clear of what questions are being asked within the screening tool and how that information is being used as well. And so a couple other, I'm not going to go too in depth to these additional elements of the tool, but also just thinking about what does integration of reporting look like. These are all considerations that we're grappling with if folks want to use it to really inform their continuous quality improvement efforts. How are we going to find a way to streamline data collection, customize any kind of reporting, and reporting in the sense of in the aggregate form to help inform what how that might change the service array in that specific county or region. And then using how could we embed some feedback and iteration, so feedback cycles and look at how scalability might work and ongoing updates over time. And so this, I'd say all these are being key elements of the tool in the sense that based off of what we might produce as an example for folks to utilize, but also knowing that this is never going to be a requirement for counties or tribes or anyone, right? But this is going to help give examples of how they could build their own screening tool that meets their specific community needs, taking into consideration some of these specific elements. And so I wanted to share a little bit about what we've actually done so far. So I talked a lot about where are we really hoping the screening tool will accomplish, but we've really started with a landscape scan. So I shared that we did a lot of looking at many different screening tools across the nation, and I'm happy to share a list of what we've come up with, what we've been able to look at, what would meet our needs versus not. And so we did complete that scan. We looked at, we saw it didn't really meet California specific needs, but we're looking to adapt them as we can to make sure that we are pulling from maybe screening tools that have been validated, right, for some of the questions that they've asked, but knowing that this screening tool, might not necessarily right now be in a validated form, but it might be something to help prompt future opportunities for evaluating and expanding. But where we're at right now actually is really in the constituent engagement phase. So we have talked with our Linkages PEI committee. We talked through with them, built some work groups around 3 counties. We've had a range of small, medium, and large counties to help do some information gathering to understand what would you all need that would be feasible to actually implement within your offices or in different programs. So we've collected a lot of different feedback, and we engaged the PEI Linkages Committee consistently over time. We also have developed a statewide survey. And so that's what we'll be sharing with you all today, and hoping you can share with your networks and be able to complete yourselves. But we've actually developed a draft screening tool with questions based off of our findings and with a survey attached to it, so that we can see, are we hitting the marks? Where do we need to shift? What other areas do we need to explore? And then what are some actual implementation strategies we need to consider? And then once we conduct that survey, we're hoping to have some focus groups, key informant interviews, so that we can further dive into the qualitative aspect of developing the screening tool and really getting to the nitty-gritty of where do we need to shift in this screening tool, or what do we really need to consider as we build it out and provide as a resource for counties. And then developing the screening tool and implementation strategy, again, that will all the work happening in the constituent engagement phase will inform how we're looking at developing a final example and how folks might be able to implement. And then I think, beyond that, once we get to this phase of really being able to have a screening tool, identify an implementation strategy, we're really looking to start with finding some pilot counties to be able to start seeing how could we start embedding it within specific counties, and then having some evaluation component behind it in the sense that we really just want to measure, is this actually meeting the needs of the counties? Is it feasible for counties to implement? But also, is it meeting with the ultimate goal, is it meeting the needs of families, right, through this process? And so we do hope to, as part of a larger initiative over time, try to implement a training, some kind of orientation to the tool, to make sure folks are able to fully understand what will be, how would we actually put this tool in practice? How can we actually adapt it? What are some different maybe web-based version tools that our county can build from it? And then we want to, maybe for those counties that are able to utilize or pilot the tool that we developed, we want to have some test user, pilot the self-service tool with some understanding the test user experience, but also understanding how to, assessing what the language and cultural responsiveness was with that screening tool as well. And then ultimately, hoping to over time evaluate outcomes from that, and ongoing, in this larger CQI process of informing how we adjust or modify that screening tool. So before I talk about next steps, I know I talked a lot about the screening tool and its development, what we're planning. Are there questions? What are folks' initial reactions to it? Does this seem to make sense? Do you see any challenges with a screening tool and embedding it in self-sufficiency programs, or what do you also like about that? So many different types of questions, but feel free to jump in if you have any immediate reactions. Are any of your communities doing something similar in which they're implementing some kind of screening or needs assessment? Great, Edith, I see you have the question in the chat. How will the screenings be shared, for example, to CBOs? Great question. I think that's part of what we're going to try to understand more throughout the constituent engagement process. But I think that and maybe that's a phased approach over time where CBOs can build it into their process within the county. But if this makes sense for an individual county or region, then maybe it could be that they, that's where their starting point is, right? We know that CBOs are already doing some form of needs assessment, but also how do they connect that or maintain that communication with when folks are going into the self-sufficiency or public assistance offices? Because sometimes the families are entering those offices and but they aren't connected to any kind of CBO, right? So I think that's where we're trying to catch the gap for families that are maybe not already connected to supports and services, but are interested in receiving those. But Dana, I see you came off mute. Feel free to
Yeah,
jump
I
in.
just say that you had a comment in the chat. I don't know if you can see it. You want me to read it?
Oh, is that by Carla?
It's about a tool that they're using in their school-based, I think, services.
Yeah, that's great. Carla, I think I'm not sure if you have anything to share also, feel free to jump in regarding the measuring outcomes. I think it can be challenging measuring outcomes, especially when we're thinking about if this is a one touch for a screening tool, if there's no really not able to do any follow-up after that. I mean, that's where it gets hard to really measure the outcomes, right? So I would love to learn more about that FDM tool that you all might have.
Yeah, it's more of a needs assessment for the family, trying to figure out what type of services we can offer to the family. But then how do we measure the efficacy of our work, right? And that's where we're kind of falling short on that. And we're trying to develop a database to input all the information, but it doesn't make sense to me. And if it doesn't make sense to me, it's hard for me to sell it, right? And especially to a staff who's doing it. It's a great tool when you're working with the family. But then there's so many factors that determine whether they receive the services or not, whether the services were effective or not, and how does that relate to the prevention work that we're doing.
Mm-hmm. Mm-hmm.
I would jump in to say, and even with a screening tool like this, it might be the outcome might just be connection to the service at all, right? And then the service outcomes might be tested using another CQI process. Because I think our first biggest hurdle as we implement the community pathway is getting people to the service that they will find useful to them. One of the things that we've also talked about as we work on this tool is that counties or pathways or organizations will be able to use it in various ways that work for them and may be able to build those communication processes from where the screening tool happens to the community service provider through a variety of mechanisms, including what happens now for differential response, for example, in connecting families to services in the community. These are all really great aspects of the work that we have ahead of us as we think through all the ins and outs of developing and implementing this screening tool.
Yeah. And I just wanted to also lift up that Riverside talked about they use a screening tool at their hotline that to sort of help determine needs too.
Can I add? So I'm with Catholic Charities of Santa Clara County, but we are funded by First Five. So we use the ASQs, the Ages and Stages Questionnaire, the Ages and Stages Questionnaire 2, and the SC3, so for social emotional. And that's what those are the assessment that we're providing to families directly that we work with. And it is a challenge, even though, you know, we offer to the families, because the families can still decide not to take the services further down. So if we, you know, and it is used as a prevention, right? Early intervention prevention tool. But even then, the families decide at the end of the day, you know what, I don't want to be referred, or they are referred and then they decide not to take the services. A different something aside from this is, so the city of San Jose just recently started with it's called a Children and Youth Master Plan. It's called Children and Youth Master Plan, and I'm part of that committee. And they've been trying to develop a screening tool that could be used through all the CBOs in the county, right? That it's just one, so we're not having the families do an assessment for one agency and then doing another assessment for another agency, because that's what's, you know, that's, we don't know who's been receiving services already, who's already worked with, who's working with what agency. So and currently, so they were talking about maybe like, how can we use the CANS assessment, which is something that the county of Santa Clara uses, and develop around that to have one assessment tool that would be used to assess the needs of our communities, right? And then working with the different, so it's actually a big group of the different CBOs in the community, and within the county, along with the county of Santa Clara and the city of San Jose, working together to figure out how can we build a needs assessment, or it's a tool that is just one tool that can be used by all of our agencies. So that's in the work. I know that, you know, a lot of the questions that come up when something like that is brought up is the HIPAA related service, like, you know, how much information can we share among us?
Yeah, and that's such a great point, Noemi. It's Noemi, right? I wanted to make sure I pronounced it right. Okay, great. I think that's such a great point, and because I think and that's part of, I think, what we're going to be doing in our continued information gathering process, because we don't want to develop something, right, that we then are able to share with counties, and it's like, oh wait, we're already moving down this road to develop something for our community pathway. And so I think that's going to be the essential feedback that we're going to need to hear from folks, is like, what are you all thinking through this process? Because I love the idea of building out, whether it's a needs assessment tool or it's just a way to connect families to services, building it out where there's consistency within the county and region, right? But also make sure it limits the different types of intake and screening that the family has to go through. Because the concern that I think we might hit is that if we do the screening tool and then they're referred to a CBO and then they do another needs assessment, all these different factors, right, that are, you know, they're having to go through each of these processes to get the service. And so I think what county is when this is rolled out at the individual county level, what they're going to have to think through is, how do we embed this so that there's those communication mechanisms happening? Go ahead, Melissa.
I just wanted to say a little bit about the difference between an assessment tool and a screening tool too, because I think the tool that we're trying to develop is not going to assess the family for where they are on a continuum of need with regard to specific services, but will identify who might benefit from being referred to that specific service. So we're not digging into a lot of really deep questions. It's very brief. And even though we tried to cram a lot into the 20 questions, it's definitely not providing a full scope assessment that will need to happen after the family elects to go in and become involved with a service.
Yeah, thanks so much, Melissa, for giving that distinction, because I think it's really just, what are those immediate needs that we can help route families to the appropriate services that they're seeing or that they're wanting at that moment to help connect them. Noemi, did you come off mute?
So just to add a little bit more context to what the counties, or what, you know, with this Children and Youth Master Plan. Yeah, so the initial touch is a basic intake, And then within that intake, there's a few questions that will pop up. If the client answers yes to, like, are you, say for example, do you perceive you will be homeless within the next 72 hours or something like that, right? Then there will be additional questions to drop down or additional questions to answer, so we can identify if the client, or if the client needs, it's like a light touch, more like, okay, here are the services you need, you know, here's a flyer, here's some information, or really digging into the prevention and support, more of a guided service.
That's really helpful to understand how that is, because I think what will, you know, and I think just thinking back to where we're starting at with this screening tool is, because I'm not sure of other counties' plans to maybe embed something within self-sufficiency or public assistance offices in your county. But this might be, I'm wondering if there's ways to complement one another, to say, like, this is helping to identify, you know, there's that one immediate question, right? We see housing is a specific need. We can, you know, connect you with this specific service and support. And I saw somebody in the chat mention the idea of, you know, if they select this item, how could we populate some resources for them to refer them to immediately? Love the idea of that. And I know that's part of what we're thinking through for how we can actually operationalize that. But I just love the discussion of thinking about how could we complement those different areas, but also understanding that we really want to start to embed something within those self-sufficiency programs where families might not already be connected to a service, but are still having those needs come up. Go ahead, Melissa.
I wanted to jump in and share. I really agree. I'm really hopeful that through using this screening tool, counties can have a version that embeds those programs available in their county that are identified as meeting these needs. We've tried to put some questions in there that will help establish if a family meets eligibility for specific EBP. We've tried to fit in some questions that will include FSPS candidacy criteria, so that it's really a head start into connecting families to those services in your community pathway and having information already that they'd be eligible for that specific program. I also wanted to just add, we have a wonderful grad student from UC Berkeley working with us on this project who fell ill today and wasn't able to join us, but she's in public policy and is really bringing a lot of thought to those back-end considerations of how we would share information, how we would fashion the tool so that it brings you to a place where you can actually access a service, and what the pros and cons are of different ways of doing that. So she'll be continuing to work with us on that through May, and not solving the problem necessarily, but thinking through different options or ways that we could approach it.
Great. And so I think just knowing, I know we have about 10 minutes left, but I want to make sure we have some time to talk a little bit about next steps. What we're hoping that folks that are joining us here today can help give us some feedback on the draft screening tool that in those questions, but also I think it goes beyond just that, knowing that just to be clear, that is not a final version of the screening tool. There's much more to flesh out, but we wanted to give folks some things to respond to. And what we're initially thinking of different areas to be able to assess for families and screen and refer out for services as they complete that screening tool. And so we need your feedback. So I dropped that in the chat. And that's where we're deploying that statewide survey for feedback. So please share. I think where we're really trying to get some additional feedback as well is from folks that are, you know, have experience or are currently experiencing you know, utilizing services within self-sufficiency programs. So folks with lived expertise to be able to share some of their feedback on what would be the most effective or helpful, as well as our statewide partners and counties, agencies, and so forth. After we complete that, there is an option to share in that survey if you would like to be a part of a focus group or key informant interview as we get more into the in-depth information gathering phase. Please share your contact information if you are interested. And then we'll continue refining the example and the draft screening tool as we get additional feedback. And then we're also working on by summer having an example implementation plan. And then hopefully, you know, over the time, I'm not sure, I'm hoping maybe in the next year or so that we have some kind of piloting phase or piloting approach to be able to pilot what a screening tool looks like. But we know that this is going to be a very we want to be intentional with the process to get as much feedback to make it the most effective as possible. And so I see, Charlotte, one way of possibly gathering data is at the end of the survey that provides links as that they return and indicate which resource they utilize and if it met their needs. Yeah, that's great feedback. And I think ways that we can think about how could we do some additional follow-up, you know, after the fact of referring out to make sure that we get that feedback loop to make sure that it's still effective, right? So I think that's a great, we'll save these comments to include within our considerations as we move forward. I did want to just, you know, share a brief activity. Oh, Melissa, were you planning to jump in? Sorry.
No, I wanted to.
No worries. I wanted to share a Mentimeter as folks think about as we think about areas to prioritize within a screening tool. So we think of, you know, housing or family dynamics, family challenges, stressors, all these different areas that there's many things we could screen, you know, have in a screening tool, different domains or areas of need. What would be the biggest priority that you would think, and from your communities, that you would see as needing to be prioritized within a screening tool? And so if you could just take a moment, you could scan the QR code here to share your response. Or if you went to menti.com, you could type in the code at the very top. So we'll give folks just a couple of minutes to respond to that. Great, so we see basic needs. Housing, domestic violence support, food, concrete supports, housing resources. I see information that the state will want to report on. Let's see that covered over there. I'll give folks a few more minutes and then I'll take this just so folks can get it. I'll take this down. I see there's some others that have posted on here. I see a lot of housing support networks. And then for the state wanting to report on, I think it would go back to like, how would your county or community want to utilize reporting to assess improvements? I know that this is going to be voluntary for, you know, not anything that's required by the state at this point or anything. So it's really going to come down to how do you want to embed that within your CQI process, or within maybe thinking about counties that have their program improvement plans. You know, there are different ways to embed it within those processes as well. I see concrete supports. I see, again, domestic violence, resource connectivity, basic needs again. I hope folks have this. I'm going to take this down so we could see parent access to health services. I think there's the whole other area when we think of needs for, you know, especially with the rollout of CalAIM in connection to their, you know, maybe enhanced care management or other community supports through that. Literacy. So we definitely have an educational component within our draft one. Would love for feedback on that if you have any. Mental health, protective factors, and then interest. I love this interest. I think that gets back to some of their strengths and how they can leverage that as well. So love that inclusion. Access to internet and technology. I think that's an important piece. And then I saw this one hover over here, ensuring the employees giving the screening know how to connect them to resources that they are requesting. So that's definitely an important part of our implementation plan. So feel free to drop in more thoughts that come to mind. But I know we are getting close on time. So I'm gonna stop sharing.